Hi there, my name's Jo Gamble and I'm a functional medicine practitioner. As well as that, I have a fellowship in integrative oncology and I've specialised in this field for in excess of 10 years now. I want to talk to you today a little bit about the terrain of cancer. Why? Because I believe that there's things that we can do alongside conventional medicine to make a difference. This is personalised medicine. And instead of one size fits all, this is making cancer support unique to you, the individual. And why wouldn't we want to use every tool in my kit bag to ensure optimal well-being for you during or after your cancer diagnosis? So my work as a fellow in integrative oncology is to give you that personalized approach to work alongside your medical team. But like I said, to give you the best possible chances of changing the terrain within. So functional medicine approach to any pathology, so any disease, any symptom, is to look at you as a whole person, not a unique part within you. So let's take, for example, you've got problems with your gut. You go to see a gastroenterologist. You then might have problems with your joints and you might get referred to a rheumatologist. You might have the need for a bone surgery and get referred to an orthopedic surgeon. Or you might have a problem with your kidneys and get referred to a nephrologist. How functional medicine works is to look at all of you as a individual, as a collaborative group of those symptoms. So I don't cut bits of you off and go and send them to a different person. I work with each and every symptom that you are presenting with. Now, when we think about this in regards to sort of what the difference between functional medicine and conventional medicine is, conventional medicine focuses on diagnosing a disease, followed by prescribing a drug to either cure or manage the symptoms of that disease. This is brilliantly effective in acute situations. Oh my goodness, if you have a road traffic accident, please call 999 and get a paramedic out to glue you back together. They can do phenomenal work, orthopedic surgeons putting your bones back together. If you were diagnosed with meningitis, you would absolutely need those antibiotics pumping through your veins very, very quickly. The problem with conventional medicine is it doesn't really fit into chronic diseases, much more acute disease model. And this is where functional medicine really trumps the working with people with those chronic diseases. Functional medicine is a science-based approach to health and healing that looks at the origins, the underlying causes of the illness or symptoms. It's a comprehensive approach that emphasizes not just restoring health, but also the prevention of disease in the first place. Now, with statistics being as strong as they are towards cancer, 1 in 2.3 of us are going to get a cancer at some point in our lives. Each and every one of us should be focusing on prevention. So functional medicine constantly seeks to understand why. So in this instance, why did you get cancer? Why did your loved one get cancer? Why does the person have the illness or the symptoms? What is the person's unique genetic makeup and their individual experiences during their life that may have resulted in the health problems they're experiencing? Now, let's make this about the hallmarks of cancer. So on the right side of my screen in the green text, you can see all of the different hallmarks of cancer, including the one at the bottom, the genomic instability. The reason I've put genomic instability in red is because it's the only one we cannot control. We cannot yet change our genome. Maybe in time that might change, but today we can't. But yet each and every one of those green text hallmarks, we have the ability to make changes to. And this is what my skill set utilizes, is trying to change the microenvironment that encourages cancer pathogenesis, stopping the terrain being pro-cancer to try to make it anti-cancer. Like I said, we can do this all the way alongside your medical doctor if you have a diagnosis, but we can also do this as part of our protective mechanisms to prevent. So the tumor microenvironment contributes to every aspect of carcinogenesis. And yes, we need to understand that genetic stability or instability, as I often describe it to my clients. Genes load the gun, but the environment pulls the trigger. So we also need to start thinking about the environmental influences, things like gut dysbiosis, so imbalance in the bacteria within your gut, things like total toxic burden, how toxic we are, stress, hormonal imbalance. These are just a few of the environmental implications that could have influenced the pulling of that trigger. And in understanding each and every one of these, we can dig down deep and find out all of the whys in you so that we can start to put these right again. So we can start to rebalance these whys. And the complexity is as complex as this roadmap here. But that is the beauty of functional medicine. We have a bit more time. We have the skill set to dig down deep and put together your unique roadmap. And then we can start creating a journey from start to finish as effectively and efficiently as possible. Now, everything that I do is about looking below surface level, looking below what you can see to the naked eye. And this might include a stool test to ascertain microbial imbalance in the gut. It might include hormonal imbalance, not just to look at your blood levels of estrogen, but look at the ratios of those estrogens. There is more than one type of estrogen that's important when a hormonal cancer is involved, for example. It might involve looking at different toxic burdens. It might involve looking at your full genetic blueprint. So this is all going on below surface level. And then we work to manage the terrain, and we do that together as a team. We work to reduce oxidation. Oxidation drives carcinogenic behavior in the body. We work to resolve infections. If there's chronic infections in the body, things like Helicobacter pylori, a bacterial infection in the top of the stomach, things like Epstein-Barr virus, which is glandular fever, or HPV virus, we can work to reduce, we might not eliminate, but reduce your total viral load. We work to control inflammation and modulate your hormonal levels. We work to modulate immune function, not enhance it if you're on treatment, but modulate it, help to balance it. We work to enhance detoxification, regulate your blood sugar levels. These are all things within our capability. Now, cancer is referred to as a metabolic disease. So understanding your cellular energy, your battery cells within every cell of your body is so important. It's something I work with my clients to ascertain. We should have a regular working immune system. That immune system should encourage an internal scanning system of our body. But if that immune system has gone out of balance because it's so busy fighting maybe a chronic bacterial infection, maybe one that's completely asymptomatic in you, meaning you're oblivious to it being there, then it's not doing its job. And maybe because you've got chronic inflammation, then your immune system is too busy getting messages from other places in your body to realize that some rogue cells have mutated inappropriately and it should be doing something about it. So look at all of these bi-directional arrows involved in my functional medicine approach. I need to work on each of these different parts of your body, systems within your body, but pull them together as a whole to really let me and you get our teeth into optimizing balance within the body. Now, a few other systems that we always want to think about, and the first one is thinking about imbalance within your gut. You can see that there's 100 trillion gut bacteria within that gut, and its job is multifaceted, from regulating immunity to inflammation to even regulating our moods and having a massive impact on things like our cardiovascular health. But yet when that gut, it goes out of balance, all of those functions are compromised to some extent. So think about your gut. Do you suffer with constipation or diarrhea? Do you have bloating, excess gas, reflux? These could all be symptoms that your gut is out of balance. And we would certainly want to put those back into balance. And then think about hormonal imbalance. Now, this isn't just in women, there's also hormonal dependent cancers in men, particularly prostate cancer. So the myriad of the network involved in hormonal balance is huge, from regulating sleep to blood sugar levels to sex hormones to thyroid hormones. The list goes on and on. And I often describe hormonal balance like a beautiful orchestra that plays in perfect harmony, but you only need one musical instrument to go out of balance for the whole of that output to be dysregulated. And that's how we look at hormonal imbalance in each and every one of us. Now, we live in a pretty toxic world right now. And what we want to think about is your toxic, let's think of it like a toxic bin. And we fill that toxic bin with food sprayed with herbicides and pesticides, environmental toxins, pharmaceutical drugs, flame retardants, which is on all of our new carpets and sofas and in new cars. The list goes on and on. How full is your bucket, and how much do we need to empty that bucket? And part of that emptying process is how efficient are you at clearing that waste? And genetically, some of us are more efficient than others. Even though we might not think we're coming into contact with many toxins, if we're not efficient at clearing them, over our lifetime, that burden has increased. And that's definitely something we need to encourage. So, like I said, we are now very, very aware of the hallmarks of cancer. And what we want to do is to work to balance these as effectively as possible. And this is where we integrate the functional approach alongside the conventional approach. This isn't asking you for us or them. This is bringing it together all the way through your treatment and beyond for years and years and years. So we need to think about some of this cascade. So there might be some low-level inflammation in our body. Many of us have low-level inflammation. It might be at a joint level, a bit of stiffness. It might be in our guts. The list can go on. It might be linked to our periodontal health and low-level inflammation in our mouth. This can cause damage to our tissue. We then get stem cell infiltration or activation, environmental, epigenetic, immune and hormonal effects on stem cells, and this can trigger abnormal growth patterns. So who to believe that low level of inflammation could be the driver of cancer? Now, why do some people retain or are more sensitive to toxins than other people? And this might be due to increased ongoing exposure, deficiency in essential nutrients that help us to clear those toxins, could be linked to high sugars or low protein diet, heavy metal exposure. And this could be something you're oblivious to. It could be in your pipework of your house, stress and an emotional trauma, intestinal dysbiosis, back to those bacteria, or variations in our genetic ability to detoxify, otherwise known as SNPs, single nucleotide polymorphisms. Or how I describe them is typing errors in our genetic makeup that could have a negative approach. Now, obesity is definitely something that we're seeing increase over recent decades. And with obesity, we often see an imbalance in our blood glucose regulation. Now, don't think if you're not obese, you are not a candidate for this. In fact, we're seeing more and more skinny, insulin-resistant people. Now, a cancer cell has between 10 to 20 times the receptors to glucose as a non-cancer cell. And that has been proven, and it's used in oncology treatment when you undergo a scan and a radioactive isotope is put into pure glucose, injected into your arm through a cannula. The cancer cells will take up 10 to 20 times the fold of the glucose and thus the isotope. So when they scan you, the tumours will light up, and that is what an oncologist sees. So even if you're not obese, you do still need to think about regulating your blood sugar levels in order to reduce that source of fuel. And insulin is a known growth factor. Elevated levels of insulin in your pancreas is like a little factory. Every time we eat sugar or carbohydrates, the factory pumps out insulin to be able to get the glucose out of your blood, so that we don't end up with too high levels of blood glucose. But this could also be a risk factor in some kinds of cancers. Tumor cells exhibit more insulin receptors than normal cells. Now, epigenetics refers to the markings of our genes, and certain food is great epigenetic modifiers. Things like green tea, which includes the ingredient EGCG. Our brassica vegetables, our broccoli, our cauliflower, our curly kale contain indole-3 carbinol, which is especially beneficial for estrogen-dominant cancers, but also is an epigenetic modulator in optimizing immune system health. The list of beneficial foods goes on and on. This is really getting to grips with food as medicine. And we know that many cancers are associated with the diet of the Western world. So the reason that we're hitting epidemic levels of cancers is because of the change to the Western diet. And therefore, why would we not want to make changes to the diet as part of your cancer protocol? It's just about saying we can change those pro-inflammatory foods that we get from our processed red meats, for example, our white starches, and increase more anti-inflammatory foods, which we get from oily fish, turmeric, ginger, have all got anti-inflammatory properties to them. Why would we not want to take out the flavor enhancers, things like monosodium glutamate, which is in lots of processed foods, highly flavored crisps, Chinese takeaways, and use more natural flavors, herbs, spices, which are so cheap to flavor our food? Why would we not want to include more of those foods with epigenetic modifiers in there? The brassicas, the green tea, the ellagic acid, which you get from pomegranate, the lycopene, which you get from tomatoes. The list goes on and on. And I support my client to incorporate these foods within their diet on a day-to-day basis. And this is using nutrition therapeutically. Now, this can also help with maintaining blood levels so that we don't drop our white cells too low, our neutrophils too low. It can help the liver to handle the effects of the pharmaceutical drugs. And also we can use these foods to not only support mood. Foods rich in tryptophan helps with the production of serotonin, our happy hormone, but it also helps you and your loved ones to feel as though you are doing something proactively to help yourself or your family members, which is so important during this journey. So cancer is a metabolic disease. So what are some of the things that we know are important, including a plant-based diet, including regulation of inflammation, regulating our glycemic index, the sugar in our body, optimizing a healthy microbiome, intermittent fasting, taking energy away from digestion and focusing it on all of the other functions, which is so important at this time, like immune regulation, reducing obesity and reducing alcohol consumption. We also know that diet influences oncogenes and tumor suppressor genes. We know diet influences the tumor microenvironment. So why wouldn't we want to use food as therapeutically as possible? And you know what? My biggest gift to you is to support you on your journey and maybe make the impossible possible. I love my work because I know I am very talented in this field and I can make a difference on whatever level that is possible for you, the individual, by giving you tools to help you to be as much in control as possible. If you need some more support in your journey or your family's journey, then please do come and visit me and let me be part of your team on your journey. You take care. Bye for now.